If you're wondering what internal medicine residency is like in Germany, then keep watching. Hello my people, welcome back. I hope you're all doing well. Just in case you're seeing this face for the first time, my name is Lucinda. I am a medical doctor practicing here in Germany in internal medicine. Quite a number of you have asked, what is internal medicine really like in Germany? So today I'll be sharing my experience, what I like about internal medicine, and why it might or could also be for you. Let's dive right in. So when it came to picking a residency position, right, internal medicine as a specialty for me was a no-brainer. I had not seen myself doing anything else outside internal medicine. So while I was in med school, most of the things I had interest in were all in internal medicine. And we know how broad internal medicine is. So when it came to picking a specialty, internal medicine came very, very easily to me. The first thing I like about internal medicine is the fact that it is broad. Internal medicine has lots of sides to it. So internal medicine reminds me of a mansion with many rooms. So in internal medicine, you're dealing with multiple organs. You're talking the heart, the kidneys, the lungs, and everything your eyes cannot see. So I truly love the fact that you never get bored. So it's too much going on to get bored with one organ. So if you get bored with the kidneys, you move to the lungs. So it's just the knowledge and the depth you get from internal medicine. I also like the fact that internal medicine forces you to think in systems. And most of the patients you would encounter in internal medicine have comorbidities, so they won't have just one ailment. So it forces you to just ask why is this so, why do we have that, what's happening here, you know. So it just opens your mind to complexities. Another thing I really like about internal medicine is the fact that jobs are readily available. There is a constant demand for internal medicine doctors, both in hospitals and outpatient clinics. There is some kind of job security. You know, if you start somewhere and you don't like it, you have other options. You're not just tied to one place just because you might feel, oh, it's difficult to get another position, especially because you know you're needed somewhere. If they do not appreciate you here, you pack your bags and you know they would take you somewhere else. Can we also talk about the endless career flexibility you have in internal medicine? So let's say you go into residency and you haven't fully figured out if you want to do gastroenterology or cardiology or nephrology, for example. Internal medicine gives you that door. But then if you decide to subspecialize, I love the fact that you have an endless choice to choose from. So it doesn't limit you in any way. You have gastroenterology, cardiology, rheumatology, endocrinology, diabetology, the list goes on and on. It also gives you the opportunity to open your own outpatient clinic if you want. You have a choice. You could stay in the hospital, you could decide to go outpatient, whichever one you want. So I also love the flexibility that internal medicine gives in that regard. Over time, you just realize you're becoming more confident. So internal medicine gives confidence in a way because you get so much knowledge from treating patients with so many different kinds of ailments every day. And that sort of gives you confidence, not confidence that is rooted in pride, but confidence that is rooted in experience and knowledge. So that's something I really, really love about internal medicine. At the beginning, it feels a bit scary, but with time, you get used to it and it just gets better. Internal medicine is definitely not for everyone. Internal medicine, I think, is for those people who love to think in systems, who like complexities, because internal medicine is quite complex, I must say. And for those people who haven't quite figured out what exactly they would like to do. So sometimes after med school, you know, you just haven't figured out exactly what you'd like to do. Internal medicine gives you options. It lets you in and the doors are endless. Like I said, it reminds me of a mansion with many rooms. So you could come into this mansion and decide, okay, let's go to room 1, room 2, let's go downstairs, and then figure it out as you go. If you have watched up until this point and you haven't subscribed, as usual, I am asking myself why. Please do well to subscribe. Having said that, let's move on to our question of the day. So this question is from someone in the comment section called Courses for short. It's a long name, but I'm just going to use Courses. And the person says, "It's so nice to have you back, Lucy." Hello, it's nice to have you here as well. Please, can you tell us about internal medicine residency program in Germany, the durations, the schedules and expectations, and how to navigate the process? So let's unpack this gently. Internal medicine is a 5-year program in Germany, and within the 5 years, you're expected to do rotations in different specialties like gastroenterology, cardiology. Intensive care is about 6 months. You have 6 months of ER. So all these are compulsory. What does the schedule look like? So you could start at 7:45 and work till 4:15, or you could start at 8 to 4:30. If you're working full-time, you have 30 minutes break each day, which most people do not take in internal medicine. But like I've said in the previous video, you have to make sure you take your breaks, else you will work endlessly. You have your regular days, like I just said, but you also have to do shifts because the nights, public holidays, weekends has to be covered by someone. So there are shift models, different shift models depending on the hospital. Some hospitals offer like the 24-hour shifts, and most hospitals expect you to do at least 1 in a week. So at least it's like 4 shifts per month, but it also depends on the availability of the doctors and if other people want to do more shifts and all that. So there are different shift models, but the 24-hour 12-hour shifts are common in Germany. So when it comes to expectations, I think a lot is expected from an internal medicine resident. You're expected to be able to care for your patients. Of course, you have senior colleagues, you have your attending, but they won't be there 24/7 with you. And the higher you go from level 1, okay, from level 2, the higher you go, the more the expectations. You're expected to be able to do 9 shifts and just keep your patients alive. Of course, you have help from your attending when you have questions, but there is a lot of expectations when it comes to clinical management of your patients and doing certain procedures. There is also a lot of expectations. And how to navigate the process? I would say as long as you're willing to learn, as long as you're willing to push yourself, you would be fine. With internal medicine, there's a lot of administrative work going on. You could start with administrative work and finish residency just having done lots and lots of administrative work. Internal medicine, at the beginning especially, even midway, you feel like a secretary with a stethoscope. I'm not kidding. Those who are in internal medicine will testify to this in Germany. So there's a lot of administrative work, paperwork going on. But navigating it to make sure you actually learn, you have to push yourself in Germany. No one would be holding you and pushing you. It's not like other countries where you're forced to learn certain things. In Germany, no one is pushing you anywhere. You have to just make the conscious effort to learn and to just stick with those who can teach you. So if you have senior colleagues, you have attendings who are open to teaching, always just tell them, oh, when you're doing this procedure, please call me. When you're doing this, call me and ask questions. It's better to ask questions than just think you know it or just hide or shy away. Because at the end of the day, the one who asks and gets the info is way better than the one who's just covering things up. Even though sometimes you might think, oh, I look stupid, but it doesn't matter. As long as you get the knowledge you seek, then you're good. It doesn't matter what anyone thinks. It all works in your favor. In internal medicine, documentation is very important. Document every single thing. Documentation, document, and document. It would save you from a lot of things. That's something I would also say. Having said all these, I hope that answers the question. If you have questions, or if you're already doing internal medicine, what has your experience been like? I will see you in the next one, and as usual, please do well to like, share, subscribe, and take care of yourselves. Bye.